This is our main form. This is how the form you will use to submit what is called your physical therapy progress note. This is the form that you will use to submit your notes on a daily basis. You must submit one of these per patient. And while you are doing this, please do not submit duplicate progress notes. And what we mean is saving one to your desktop and just changing the name at the top of the form. You must fill out one of these independently for each patient you see. For this progress note here, you will start off in this section where it says agency, and like we did before, we'll just type in Bethel. And just as we ask you on the policy and procedure examination, all treatment visits are to be done at least 45 minutes to an hour. So we would say this one started at 11:01 a.m. and went all the way to 12:03 p.m. Here where it says patient's name, you would put in John Doe or the patient's name. Where it asks for vitals, you're going to put the patient's vitals here. We'll say 130/78. The pulse, you're going to put whatever the patient's pulse was when you took it. We'll just say 74 here. Respirations, we'll just say 20. And on the pain scale, you would ask your patient, 0 being no pain at all, 10 being the worst pain imaginable. Where would you scale your pain? Say, for instance, this patient says 5. You would go here to this section. If he or she says it's in his arm, you would say right arm. Where it says subjective here, this is where you're going to type in what the patient says to you when you come into their home. You might come in and say, Mr. John Doe, how are you feeling today? And you might say, I'm feeling fine today. Here in this patient, you would say patient. In this section, you say patient states that he is feeling fine. And that will complete that section. Then you would skip down here to the first exercise, or one of the exercises you did with the patient. Say, for instance, one of them was shoulder flexion and extension. You would say patient performed shoulder flexion and extension times 10 reps. The next exercise, you would almost write the same thing. Patient performed calf raises to both lower extremities times 10 reps. In the passive, we'll say something like patient performed straight leg raise to both lower extremities times, we'll say 15 reps. Here in the stretching part, we'll just put something very simple. We'll just say upper and lower extremities times 10 minutes. If you do any mobility exercises with the patient, you can put it here. If you do some supine to sit with the patient, depending on how much you help them, you could say max mod or min assist. We'll say mod assist here. And how many times they did it, we'll just say 3. And then you will continue on to the bed, mobility for rolling or scooting. If the patient did any sitting or standing or balance exercises, that would be indicated here. And you would also write the type of assistance that was given and how many reps were done. Here, when the patient does gait, this is where you're going to put down the walking, whether it was even or an uneven surface. You put down how far they walked. You say 20 feet, They did it 3 times. And that would go here. And whether they used a walker or a cane, you would indicate here. In this section here, you would write down what was your main goal for them today. And here you can write down maybe your help was the main thing here, home exercise program training. So you would type that here. And where it says patient's response to treatment or innovations, you can type patient tolerated treatment. Oh, sorry, let's put something else here. Patient responded well to straight leg raise exercises. Observations could be patient tolerated treatment well. Measurable progress, say for instance the patient last week walked only about 10 feet, so he increased to 20 feet. So here you would say patient increased gait distance by 10 feet. Here you can put down what the next goal you want the patient to be able to do. So it says towards functional goals, you can say patient was able to perform ADLs, and this is activities of daily living. In this section here, all you have to do is date the form and then go up to the top right like we discussed before, hit submit, and follow the directions on your screen. And that's all you have to do as far as submitting progress notes for each patient you see on a daily basis. Like I said before, don't hesitate to call the company if you have any questions or comments or anything that you might be thinking about. Give the company a call before submitting your form, and we will help you through it.